Hey everybody, Dr. Brett Scher, low carb cardiologist at lowcarbcardiologist.com. An article just came across my newsfeed this morning that I needed to talk about to clear the air. This is an article that says low carb diet tied to common heart rhythm disorder, and they're talking about atrial fibrillation. Now, for starters, they're talking about a study that's going to be presented in an upcoming cardiology meeting. Hasn't even been presented yet, so I don't see any of the information or the data here. They're probably just going off of a news report themselves or something. But basically, they're trying to say that low-carb diets can cause atrial fibrillation. But really, all they can say is when looking at a study that's already been done years before and data mining, they can try and correlate an association between those who ate lower carb and those who had a higher risk of atrial fibrillation. Now, definitions are important because we've seen this time and time again. So their definition of lower carb, let me pull it up here, is like 40% of their carbohydrates. It was less than 45% of their calories from carbohydrates. So again, it baffles me how someone can call that low carb. And sure, that might be low carb compared to the standard American diet. But 45% of your calories from carbohydrates is still a tremendous amount of carbohydrates. So if you're eating 45% from carbs and say, 40% from fat, that is the classic high carb, higher fat, mixed diet where you're burning glucose for fuel and you're having excess fat sticking around, being deposited in your adipose tissues and possibly getting oxidized. That is not what we talk about, what I talk about when I recommend a low carb lifestyle. That's not even close. So for a study to make headlines saying low carb causes AFib when it's not even really looking at low carb is so frustrating. But then the other thing is this concept of trying to make these conclusions from epidemiological studies. Look, people need to publish to keep tenure. They need to publish to get their PhDs. They need to publish to get more grants. There's pressure to publish studies. And the easiest studies to do are to just data mine from these troves of data and look for correlations and then try and make big headlines out of it. And that's just not how science is done. Let's see, could it be that people who started to restrict their carbohydrates had diabetes and were obese and had high blood pressure and were trying to treat those things? If so, those are the factors that cause atrial fibrillation. It's well known that being overweight and having high blood pressure are two of the most common risk factors for atrial fibrillation. So the nutritional change could have been in response to that. Also, they're the classic unreliable food frequency questionnaires that don't take into account how diets change over time, day to day, week to week, month to month, year to year. So this type of data is such poor quality. It's not even asking the right question or following the right parameters, but yet it makes these news studies. So I'm sure I'm going to get a number of questions. Is eating low carb or keto going to put me at higher risk for AFib? And I'm going to say we know as much about that question yesterday as we know today. This news study, these news releases do nothing, absolutely nothing to answer that question further. All right. I hope that helps. Hopefully clears up some of the confusion that's going to come up from this trial. If you want to know more, you can find more at lowcarbcardiologist.com. I hope everybody has a wonderful, happy, and healthy day. Take care.